Hello student, so my name is Nadira. I'm the student of MSc Nursing second year of the College of Nursing. So today I will discussing about the urinary tract infection. What is the urinary tract infection? What about the causes? And what is the prevention? How to prevent of UTI? First of all, we'll discussing about the introduction. So, urinary tract infection is a very common among females in all age group during adolescence, hormonal changes, febrovaginal colonization of bacteria which can migrate to the periurethral area and cause urinary tract infection. It is associated with poor self-esteem, impaired quality of life, social isolation, and the most that is depression. Many factors like low water intake, infrequent voiding, and poor menstrual and sexual hygiene have been implicated in UTI during adolescence. So they are one of the most common type of infection and account for among 8.1 million visits to a doctor every year. So urinary tract infection are caused by microbes like that such as bacteria overcoming the body defense in the urinary tract that can affect the kidney, bladder and the tubes that run between them. So what will be the definition of urinary tract infection? So the definition is the urinary tract includes several parts of the body including the kidney, bladder and ureters and the urethra. So first I will discussing about what is the kidney. So the kidney are the bean-shaped organ located in the abdominal area that filter blood to clean it and make urine as a byproduct. The urine travel down to the ureter to the bladder for storage. The urethra connect the bladder to the outside of the body where urine level to the body and of this part of the urinary tract can get an infection called urinary tract infection. So what will be the risk factors? What is the risk factors of urinary tract infection that cause UTI? Most UTI in females. So let's discussing about the risk factor. So some factors that increase a woman's risk for developing a UTI so include first one is age. So the rate of UTI in women gradually increase with age. What is the why the age? Because age is the another increase the age and decrease the hormonal level and the dryness of vagina can overcome the growth of the bacteria. And the bacteria is grow that cause UTI. Incomplete bladder emptying which allow the residual urine to be rapidly infected by bacteria present. That is the some risk factors and some are causes. That is the important causes that cause UTI. What is causes urinary tract infection? That is one bladder, uterine or any other pelvic organ prolapse, immunosuppression with certain medication or drug, diabetes, abnormalities of the urinary tract such as kidney, renal stone which act as a focus for infection. So let's discuss about the symptoms of urinary tract infection. So what is the symptoms of urinary tract infection? Here are the some symptoms: strong and frequent urge to urinate. First one is strong and frequent urge to urinate, cloudy, bloody or strong smelling urine. That is second one. Third one is pain or a burning sensation when urinating. Fourth one is nausea and vomiting, muscle aches and abdominal pain. Sometimes you can see in the patient. Passing frequent small amount of urine. And the second one is pus in the urine, and this one is strong smelling urine, and the last pelvic pain in women, especially in the center of the pelvis and around the area of the pubic bone. So here is the symptoms. What will be the diagnosis of the urinary tract infection? So here is some diagnosis. Your doctors, if you have a UTI and you go for a doctor for the checkup about UTI, so here is your doctor will ask for a sample of your urine. It is tested to see if there is a germ that causes a bladder infection. If you have infection, often you may need extra testing to find out why. Now we will discussing about the management. So here about some myth about the urinary tract infection. UTI is not curable. UTI is very dangerous, and it is very common disease, and it's a very curable management are available. So simply management, and this is curable disease of urinary tract infection. The first management is antibiotic prescribed by your doctor will usually cure a bladder infection. It may help to drink lots of water and other fluids and to urinate often, emptying your bladder each time. For urinary symptoms such as pain or burning, there is a medicine you can buy without a prescription. If your doctor prescribe antibiotic, take the pills exactly as you're told. Do not stop taking them just because you feel better. You need to finish taking them, also them you do not get sick again. What will be the prevention? Okay, now if the term usually we can see that the prevention better than cure. So here is a better prevention. The prevention is very important. If you are knowledge about and your awareness about what is the prevention of urinary tract infection, so that's a very much important. So prevention of urinary tract infection, you may be able to help prevent this finding. First one is avoid fluid such as alcohol, caffeine that can irritate the bladder. Okay, avoid fluid. Sometimes only drink plenty of fluid, like that some fluid alcohol, because that is not good for health, and also maybe irritate your bladder and also be very dangerous for your mind and your sleep and your peace. So avoid fluid such as alcohol fluid, avoid only alcohol and caffeine fluid, like sometimes we see that caffeine that can irritate the bladder. Wipe from front to back after urinating, and bowel movement. Usually this practice is not continue for our girls because lack of time, lack of knowledge, awareness. Yeah, sometimes that the women's, the girls, the adolescent girls don't know about the about care and about the hygiene practices regarding urinary tract infection. So that is a very important, is wipe from front to back after urinating and bowel movement. First the prevention is genital area clean. Keep the genital area is clean is much important to prevention, because the genital area are not clean. They enter the bacteria grow, and the bacteria grow, they cause the urinary tract infection and other several bacteria infection, and then lead to several other problems. So keep the genital area clean. The genital area do not be moisture. Clean and dry is very much important. So keep the genital area clean, dry. Okay, showers are preferred to bath and avoid using oils. Preferred to bath करना है, avoid using sanitary pads during menstrual. Only sanitary pad during menstrual. Avoid using perfume product in the genital area such as alcoholic perfume and soap. Avoid it apply on your genital area. And during menstruation time, avoid it cloth, because they provide moisture and they irritate your genital area, and also because your bacterial growth. Only using sanitary pads during menstruation and other sterile product during using menstruation time, and changes in time to time, because it's very much important, because moisture can occur the causes of bacterial growth. You can also be uses during menstruation time is menstrual cup. It's a very important and also be very safe and very clean practices, and very good if you use menstruation cup and sanitary pads and other. But sanitary pad, if you use sanitary pad, the changes is most important. Long time it doesn't matter. If you are using sanitary pad like that, frequently changes like that, 6 hour changes, 6 hour, 4 hour, that is the important. Wear cotton underwear and loose fitting clothing to keep the around the urethra dry, because cotton underwear is absorb any dryness. Take time to empty your bladder as much as possible when you urinate. It's most important. UTI can be prevented by ensuring proper personal hygiene and regular emptying of the bladder. As the source of the bacteria come from the bowel, it is also vitally important to clean from back of the bowel. As the source of the bacteria comes from the bowel, it is also vitally important to clean from back after defecation to avoid fecal contamination of the vaginal region. Regularly daily cleansing of the genital area with water is encouraged to practices, and all actively vaginal infection should also be treated or bacterium is separate on the urinary tract infection. So here is the some prevention of urinary tract infection that if you apply and you practice is on a daily life, so they prevent about UTI. So here is the some home remedies. Some home remedies that can cure UTI and can prevent urinary tract infection and then improve your immune system. So here are some home remedies we can be apply, and we encourage the patient to do some home remedies. So first one is home remedies is drinking fluids. For example, more and more taking water, drinking more and more fluids, and urinating frequently, because drinking more and more fluids and urinating frequently can help flush bacteria from the body. Drinking the recommended 8 to 10 glasses of water per day can also flush toxin from the body. Okay, drinking the recommended 8 to 10 glasses of water per day can also flush toxin from the body. Using a heated pad for short periods can help to relieve discomfort. And last one, it is also often said that cranberry is most important to prevent UTI. So it's often that is a cranberry and their extract called UTI, urinary tract infection. So cranberry extract do not help treat existing of urinary tract infection, but may help to prevent their development. Probiotics are available online as food products such as yogurt and other supplements. Increasing vitamin C, because increasing vitamin C intake can help prevent the growth of bacteria in the urinary tract. Vitamin C is much important for your immune system, for your growing system. High fiber food may help to quicken recovery. Getting a range of essential nutrients is also important to allow the body to heal itself. Garlic has been shown to have antimicrobial properties and may be able to block the growth of bacteria to prevent urinary tract infection. Certain foods can worsen symptoms. This include food that are hot or spicy. There's a certain foods that you should be avoided: hot or spicy, fizzy, caffeinated, and alcoholic. So thank you so much everyone for listening to me topic. So there is some summarization of the topic. So let's discussing about the UTI. What is the UTI? What is the cause? What is the risk factor, signs, symptom, diagnosis, preventions, and some home remedies. Now discussing about the conclusion. So urinary tract infections are a common problem and urinary tract infection are a common problem and can be frustrating to deal with. However, staying hydrated, practicing some healthy habits, and supplementing your diet with some urinary tract infection fighting ingredient are good way to lower your risk of getting thanks. So thank you so much everyone. First and foremost, I would like to extend my deepest thanks to my respected guide, Ms. Sabah Hashmi, Assistant Professor of the College of Nursing, whose constant encouragement, valuable guidance, and insightful suggestion have been a source of inspiration and motivation for me. Your patience and dedication have truly helped me shape this study into meaningful work. I'm equally grateful to my co-guide, Ms. Gifty Bijoy, Nursing Tutor of the College of Nursing, for the timely support, constructive feedback, and encouragement provided at every stage of my research. Your guidance has been individual and refining my work and strengthening its quality. I would also like to extend my special thanks to Ms. Zainab Faizi for this video editing, whose skillful support me in preparing the video content for the teaching program. Your technical expertise and creativity added a professional touch, making the teaching material more impactful and effective. Finally, I wish to acknowledge the collective support and cooperation from each of you, which has had made this research journey smoother and more fulfilling. Thank you all once again for your valuable guidance and contribution.